So as part of my role as a mentor at Apprenticeship Support Australia, I've dealt with many issues to do with mental health. An example of this was when I was called to by an employer who was concerned with an apprentice that had moved up from down south. He had been given a review of this apprentice before he chose to employ, and was told that her performance was very good. And when she started, he noticed that her performance wasn't what it was supposed to have been, what he had been told. He also noticed that she wasn't attending work regularly, and he just wanted to address those issues. He also noted that other people in the workplace had noticed this person had cuts along her arms, and that was something that he was quite confronted by and was unsure what it meant or how to deal with it. So I explained to him that what it could be, that it could have been self-harm, and that if he was comfortable with me talking to her, that would be a good idea. I wanted to ensure that this person had support, and was aware that her employer cared about her and that we cared about her and that we wanted her to be safe. What ended up happening was I had a meeting with the apprentice, and we spoke about the performance issues and also about the cuts along her arms. She did disclose that she did have support already, and that she wasn't coping at that point in time. Having moved up from down south was a big change for her, and she was struggling with that, trying to adapt to that. So we worked together to provide an extra informal support. So we organised to have coffee once a fortnight just to keep in touch, and she already had linked in with a medical service and a psychiatrist to level herself out. And through that, the employer saw an improvement in her performance and in her attendance at work. As a mentor, there are a range of issues and topics that come up from time to time that an employer would feel uncomfortable talking about. One of them is mental health, and that's when they can call us and we support them in either figuring out how to have that conversation, making them feel more comfortable and educated to have that basic conversation, or in this case, have that conversation on their behalf.